Good afternoon or evening. Today I want to go ahead and use this PDF that I downloaded to do some alcohol education. Basically, it's asking, is your health at risk when it comes to alcohol and how much one drinks? So we're going to go over what counts as one drink. What counts as one drink is a 1 12-ounce can of beer, 1 5-ounce glass of wine, 1 shot of hard liquor, which is 1.5 ounces. Are you at risk? If your use is taking a look at your drinking pattern, knowing your risk is important for your health, now and in the future, knowing the difference, low risk versus risky or harmful drinking. What is a low risk drinker? For men, that is 4 drinks or less a day, so no more than 4, and no more than 14 per week. For women, that is no more than 3 a day and no more than 7 per week. For people over 65, low risk limits are 3 drinks a day or 7 drinks a week. Women who are pregnant or may become pregnant should not drink. What is risky or harmful drinking? Risky alcohol use is drinking more than the single day or weekly amount shown above. Harmful alcohol use is drinking more than the single day or weekly amount shown above and having negative effects from drinking, such as accidents, not being able to stop drinking, not doing what you normally do, work, school, family because of drinking. So if it affects your daily life, that is harmful alcohol use. What can happen from risky or harmful alcohol use? I'm going to just zoom in here. People who use alcohol at risky or harmful levels are greater risk for health problems. This includes cancer, obesity, high blood pressure, stroke, injury, diabetes, accident, death, suicide, or cirrhosis. It makes a difference on both how much you drink on any day and how often you drink, or how often you have heavy drinking day. The more drinks in a day, the more heavy drinking days over time, the greater risk for problems. So tips for cutting down on alcohol use. Measure and count. Measure drinks per standard size. Count how much you drink on your phone, a card in your wallet, or a calendar. Set goals. Decide how many drinks you want for the week and how many drinks you have on those days. Pace yourself. Sip slowly. Have no more than 1 drink per hour. Alternate drink spacers. So with non-alcoholic drinks like water, soda, or juice. Include food. Don't drink on an empty stomach. Avoid triggers. What triggers you to drink? Avoid the people, places, activities that trigger the urge to drink. Plan to handle those urges. If you're unable to avoid the triggers, plan to handle. So when an urge hits or something reminds you, remind yourself of reasons for changing. Talk it through with someone. Do a healthy distraction activity or urge surf. And accept the feeling and write it out knowing that it will pass. Know your no. Have a polite, convincing no ready for times when you don't want to drink. Here are some helpful links. Again, this will be printed and given to you. The source that I got this from is the Screening, Brief Intervention, and Referral to Treatment for Substance Use. The website is on the form as well. So we're going to go over risky and harmful alcohol use and the effects that it has on your body. Risky and harmful alcohol use affects the body from head to toe. Here we go. For head, we have aggressive, irrational behavior, arguments, violence, depression, nervousness, alcohol use disorder, memory loss, premature aging and drinker's nose, gum disease, tooth decay, and mouth sores, cancer of the throat and mouth. You can have frequent colds, reduced infection resistance, increased pneumonia risk. It can cause weakness of the heart muscle, heart failure, anemia, impaired blood clotting, breast cancer, high blood pressure. It can cause liver damage. It can also cause inflammation of the pancreas, vitamin deficiency, bleeding, severe stomach inflammation, ulcers, vomiting, diarrhea, malnutrition, trembling hands, tingling fingers, numbness, painful nerves, impaired sensation leading to falls, numb, tingling toes, and painful nerves. In women, risk of giving birth to babies with brain damage, low birth weight, or other serious health issues. In men, impaired sexual performance does not include it in here, but for men and women can also cause infertility issues. At the bottom, alcohol can worsen existing health problems, so it can worsen these health problems, which is liver disease, heart disease, and high blood pressure, diabetes, ulcers, and stomach problems, depression, anxiety, and sleep problems. Alcohol is considered a depressant, so if you have depression, it can worsen your symptoms. Something to think about. Risky and harmful alcohol use frequently leads to social, legal, medical, domestic, job, and financial problems. Alcohol may shorten your lifespan and lead to accidental injury or death. This is the pamphlet, 2 pages, and will be printed out and given to you, like stated previously. So, again, this is a bit on alcohol education. I got this online at the screening brief intervention right here, and referral to treatment for substance use online. So let's go ahead and take a quick look and see if I have another resource here for just a minute. And the reason we had to do a YouTube video today is because the Google Meet was not being very productive in helping us find what we needed to find. So quick look at recovery for alcohol. I wanted to go over this timeline since recovery is your goal. Recovery is possible for everyone. Deciding to become absent can be a very difficult decision for you. However, if you were to consider how your life would be if you had to quit 1 year ago, 6 months ago, even just 1 month ago, making the decision can help reap benefits in a matter of days. The following typical alcohol recovery timeline is an effects schedule for short to long-term alcohol abstinence, as well as tips to help boost your recovery. Let me get rid of this box. Okay, here we go. So just 12 to 24 hours of alcohol abstinence. First day of abstinence often starts as a typical hangover, but as the day wears on, symptoms such as anxiety, tremors, confusion, and nausea, vomiting may manifest. If you are undergoing a medical detox, you will be administered a saline drip, as well as vitamin Bs or B vitamins, which are often lacking in long-term alcohol users. There can be some medications given for anxiety. If you are detoxing at home, the key is to stay hydrated, focus on nutrition, avoid refined sugars and fats. Unfortunately, you may not have much of an appetite, so just do your best. If you must, try eating anything healthy that you can stomach. Fruit is an example. It will get better. The good news is, even the first few hours, your blood sugar levels will start to normalize if you treat yourself appropriately. You may also be experiencing increasing heart rate, blood pressure, body temperature, and sweating. Alcohol withdrawal syndrome is potentially fatal, and medical supervision prevents relapse, which is very common at this stage. In the first 2 days, the visual, audio, and tactile hallucinations may occur. If you are detoxing at home, please do not do this alone. Make sure someone trustworthy is there with you. 24-48 hours of alcohol abstinence. For some, this may be the roughest part of the withdrawal. Insomnia and insomnia is common, as is shakiness and dizziness. Your blood pressure and heart rate should be stabilizing. Your body temperature should be back to normal in the first 1 to 2 days. Relapse is a very real threat if you are detoxing on your own. Anxiety will likely persist, and moodiness and irritability are common. Chills that feed into anxiety are common, and sleep may be impossible regardless of how fatigued you feel. Headaches and random sharp pains around the head and neck may occur in severe cases. Not everyone is out of the woods after 2 days. For some severe alcohol abusers, seizures and delirium tremens are still on the table. This is also the period in the alcohol recovery timeline in which people are most prone to relapse. However, most will find that most of the acute effects of withdrawal are over 48 to 72 hours. Anxiety may persist but improve. Sleep will likely come during this time for many. Some will continue to experience hangover-like symptoms, pain, and real desire to relapse. If confusion, seizures, or severe hallucinations occur while are detoxing at home, please call 911 immediately. 1 week. If you have made it through 1 week, you will probably start to notice a real difference. Sleep quality will improve, which will bolster daylight energy. You may notice that other negative effects of drinking alcohol are subsiding. These effects are wide ranged and can be anything from improvement in eyesight to reduction in water weight. Between 7 to 10 days, you will slowly start to feel the benefits of alcohol abstinence increase, but of course, cravings will persist. 2 weeks of abstinence. Long-term excessive drinking results in a shrinking of the brain, but by 14 days, the brain begins to replenish volume loss. Recovering users may notice a significant improvement in motor skill function, memory, and cognitive ability. Some regions associated with complex thinking, such as cerebral cortex, however, may be slower to improve in several ways. After about 30 days, liver function will show improvement, and fat in the liver may be reduced by 15%. The reduction in fat boosts the liver's ability to dispel toxins from the body. You may see a loss in belly fat and improvement in skin appearance and energy. Some people continue to suffer from some anxiety and encounter depression after the first month. Depression may result in the brain's continual adjustment and reduction in the number of neurotransmitters. If you're still struggling during the time and have not already engaged in counseling therapy, it's strongly recommended. It's the crucial turning point in alcohol recovery timeline. 3 months. After 3 months, most major bodily functions should have returned to normal, and your confidence should be well established. However, this is also a time when people may become overconfident and mistakenly believe they can either overcome triggers and temptations or are safe in having just one or two. Moreover, do not fall privy to delusions that you have this thing beat. 6 months. After half a year or so, your newfound habits will become more second nature. Being sober has completely replaced being an alcohol abuser. But remember, recovering alcoholics are always potentially vulnerable. Celebrate your sobriety, but do not take it for granted. After 1 year of sobriety, you may have noticed you've lost weight. The average weight loss by this time around 13 pounds. Your risk of many cancers, including mouth, liver, and breast, have decreased unless you have permanent liver damage. Your liver should be functioning optimally. Also, regions of the brain associated with complex tasks such as decision-making, problem-solving, analyzing, and are beginning to return to normal function. Areas of the brain respond for problem-solving, decision-making, and analysts are also beginning to recover at this time. After 5 years of abstinence, your risk of relapse drops to under 15%. So, in summary, improved vitamin and mineral absorption, increased metabolism, weight loss, reversal of some liver damage, decreased stress and anxiety, low blood pressure, improved in cognitive ability and memory, reduce risk of cancer, stroke, and heart failure. So here's some information on getting help. And this here is a resource from Believe Recovery. I will also print this out and give this to you. And that is just basically some education and information about recovery from alcohol. Thank you so much for joining me or watching this video. And I will get these handouts to you as soon as possible. Have a good day.